Many years ago, I had the opportunity to work in an emergency room for Kaiser, at that time, Kaiser Foundation Hospital, now known as Kaiser Permanente. And what I saw was tragic. I saw many people come to the emergency room when it was almost too late. I can never forget a young woman who was 16 years old, who was ready to give birth prematurely, and she was bleeding. And the emergency room doctor asked her a question, and I'll never forget her face that I see to this very day. And the doctor asked her this question: "Young lady, you're in very bad shape. You're about to have a baby. When is the last time you did your prenatal, which is the checkup with your doctor before the baby is born?" And she looked back at him with a blank face and said, "Doctor, you're the first doctor I've ever seen in my life." What we're here about today is a question that I asked myself when I got to the California legislature, especially when I was about to vote on a bill about universal health care. And the question was very specific to our communities, especially the minority communities, women, people of color, and especially the Asian Pacific Islander community, properly called now the Asian American, Hawaiian, and Pacific Islander communities. And I asked this question when I got here, reflecting back on my emergency room experience. When I think of the African American community and the strides that they have made in healthcare, it started because initial testing indicated that that community was at a higher risk for sickle cell anemia. When I look at the Latino community, the Mexican American community, I look at the strides that they have made. Certainly we haven't made enough in any area, but the strides that they have made to deal with diabetes. And I asked this question: is there a disease or an illness that we know about that's associated with the Asian Pacific Islander community? The Asian Pacific, Asian American, Native Hawaiian, and Pacific Islander, AANHPI, kind of a long acronym. And the answer was very troubling because we couldn't find the answer. And I wanted to know how our communities, of which there are 25 different ethnic groups, compared with the mainstream communities, even how we compare with each other, because we know that we are as different as the food we eat. We are as different as the languages that we say, but we are seen as very similar to the outside world.